Welcome to this guided hypnosis process to teach you glove anesthesia so that you can use that glove anesthesia in the treatment of your own pain. And just before we begin the process, what I'd like you to do is make sure that you're able to sit down comfortably with your hands on your legs or resting on the arms of a chair. Make sure that your attention isn't required anywhere else, that you can pay this your full attention. And then allow your eyes to gently close. And with your eyes gently closed, I'm first of all just going to tell you a little bit about hypnosis, just to help to demystify some myths around hypnosis and explain what hypnosis is and how it works. So as you sit there with your hands resting on your legs or on the arms of a chair, and I'll be talking here, you can just take a moment to think about which hand you would like to be the one that you make numb. I don't know whether you'll choose the left hand or the right hand, but just take a moment to think about the hand that you'll be making numb in a little bit. And now, hypnosis is a skill. There's nothing magical or mystical about hypnosis. It's just the process of focusing your attention, helping to give you greater control over your body and your experiences. And so you're fully in control of what happens here, the experience that you have. And because hypnosis is a skill, some people are naturally very good at it and can respond very well very quickly. Other people require far more training and practice, just like if you're learning a musical instrument or learning to sing. And some people who are very good at hypnosis are very good at certain aspects within hypnosis. They may be very good at hallucinating or developing amnesia, but they may not be very good at other aspects of hypnosis. And conversely, some people that perhaps aren't so responsive so quickly to hypnosis, to being able to absorb themselves and their attention, may be very good at some things, even though they're not very responsive. And so the important thing is to be aware that hypnosis is a skill that you develop. It isn't something special. Hypnosis is the process of absorbing your attention, and in doing so, becoming more responsive, which means that you become better able to carry out ideas presented to you, whether you present those ideas to yourself or have someone present the ideas to you. And because different people respond well to different things, I'll be presenting a range of different options and ideas. And you can engage with those options, and some will have greater effect than others, and different people will find different things have greater effect. And it'll help you learn about yourself. And this is just a process where I guide you by focusing your attention currently just on my voice talking here, beginning that process of narrowing your attention down so that because you're engaging and following along, and hypnosis is an active process, something where you need to be actively engaging rather than expecting something to be done to you. Under hypnosis, nothing is done to you. You're engaging, and it's your choice to engage that helps you to get the best results. And you can tell yourself, and you can be aware that each time you listen to this and each time you go through this process for yourself or guided by me, you're getting better and better, responding more and more fully. Just as you're sat there currently with your hands resting there, motionless, with your eyes closed, listening to me. And while you rest there, in a moment, I'm going to count from 1 up to 3, and on the count of 3, I'd like to have you open your eyes and find a spot in front of you to look at. Then raise your eyes up, as if trying to look through a skylight in the roof of your head, so that you're looking up, very high up, while keeping your face, your head level, facing forward, so that the eyes are gently uncomfortable. And then I'm going to count from 3 down to 1. And on the count of 1, I'd like to have you close your eyes. And the reason that I'm doing this is to help you to learn a process that you can use for yourself, where you can follow my lead initially here, where I count from 1 up to 3 and you open your eyes. Find a spot in front of you and then raise your eyes up, keeping your head straight and looking as high as you can, almost as if trying to look through a skylight in the roof of your head. And then when I count from 3 down to 1, on the count of 1, you can close your eyes and go even deeper absorbed inside, becoming more relaxed, deeper and deeper absorbed each time we go through this process. And what it'll be doing is teaching you a process you can then use for yourself. When you want to guide yourself into hypnosis, you can sit comfortably at a time it's safe to do so. You can raise your eyes up as if to look through a skylight in the roof of your head. You can count for yourself from 3 down to 1. And on the count of 1, your eyes can close and you can drift deeply and comfortably inside your mind. And you'll be able to bring yourself out of this focused awareness by counting from 1 up to 3 and then opening your eyes. And if you want to deepen that focus of awareness, you can slowly and gently, in time, with relaxed deep breathing where you extend the out breaths longer than your in breaths, count from 1 up to 3, opening your eyes, looking up through the skylight in the roof of your head, then counting from 3 down to 1 and closing your eyes, going deeper and deeper into the experience. And it's a process called fractionation, a process where you go deeper and deeper each time you close your eyes. And so that is what we're teaching here. Before we move on to numbing that hand. And so, although you may well have already noticed that the hand is beginning to numb a little, we're not yet focusing on numbing that hand. So you don't have to let it numb fully yet. You can just, for now, focus on increasing your focus internally and drifting and increasing that responsiveness to the ideas being presented. And so you can open your eyes in 1, 2, 3, opening your eyes and then raising your eyes up as if to look through a skylight in the roof of your head. And then 3, the eyes getting heavier, 2, wanting to close, 1, closing your eyes, relaxing down deeper and deeper with each out breath. That's it. All the way down gently and deeply, as if a wave of comfortable relaxation passes down your head, your shoulders, down through your body to the tips of your toes, down those arms, relaxing, calming. That's it, deeper and deeper. And then 1, 2, 3, opening those eyes and looking back up through that skylight in the roof of your head. And 3, 2, 1, letting those eyes close, relaxing deeper and deeper, all the way down, deeper. That's it, deeper and deeper inside. Relaxing, increasing your focus. Becoming deeper absorbed in the moment, aware of my voice as your body relaxes so deeply, so comfortably. And I don't know whether you'll continue to relax deeper and deeper to the sound of my voice, or perhaps to the spaces between my words. That's it. That's it, all the way. And 1, 2, 3, opening your eyes and looking back up through that skylight in the roof of your head. Holding that a second, and 3, 2, 1, all the way down deeper and deeper, as if you're becoming more relaxed with each time you do this, becoming more absorbed. And you can tell yourself, I will become deeper and deeper hypnotized each time I look up through the skylight in the roof of my mind and count down 3, 2, 1 and close my eyes all the way deeper and deeper. That's it. And it's a process you can use for yourself anytime you want to do self-hypnosis, or anytime you want to do glove anesthesia and numb that hand. And we can now take some time to focus on increasing the numbness in that hand. And you know, different people find different ways to make that hand numb. And we're going to numb the hand before you practice moving that numbness elsewhere. And so we can focus for now on numbing that hand. And I don't know whether the hand will seem like it isn't a part of you, or perhaps seem like it's apart from you. And that hand can begin to take on a soft blueness, almost like a cool sensation. Or perhaps it'll go numb with a warmth. Different people like to make that hand numb in their own unique way. Some find that as one hand becomes more numb, while that hand numbs comfortably now, it takes on perhaps a certain temperature as the numbness is setting in. And sometimes people find that the opposite hand starts to take on the opposite temperature. Others find that as that hand numbs deeply and comfortably, the other hand becomes a little more sensitive, perhaps on the fingertips, perhaps being more sensitive at noticing what the fingertips are touching on that other hand, as if the feeling from one hand is transferring to the other hand, increasing the feeling in the other hand as that hand numbs. And while that hand continues to become more numb, becoming number and number, I don't know whether the numbness will increase each time you breathe out, or whether it'll be with a coolness or a warmth setting into that hand. And there are many ways that people find they can make that hand numb. For some people, it's having a sense of someone coming over and gently placing a glove over the hand. And that glove is a glove of nothingness, a glove where everything that is within that glove goes numb. And some people find that that numbness just happens automatically. Others find that there's a very slight tingling sensation before the numbness fully sets in. Maybe some slight twitching from the fingertips as they release the last of the feeling. Some people find something else happens as the hand goes numb. Now, I don't know what you'll find happens for you, but as that hand becomes number and number, continues to lose sensation. I don't know whether that sensation will disappear fastest from the fingertips towards the palm and then perhaps slightly up the wrist, or whether the numbness will start in the wrist, as if filling the hand with numbness, like a liquid filling that hand, a numbing liquid, leading to a numbness spreading from the wrist, perhaps to the palm, the back of the hand, and down into the fingers and the thumb. Maybe the numbness starts on the back of the hand and spreads around the outside of the hand before spreading to the center of the hand. Maybe the numbness spreads down the fingertips and then back up towards the wrist. Maybe the numbness starts from the fingertips and spreads upwards to the rest of the hand, or from the palm of the hand and radiates numbness from that palm, encapsulating the entire hand. And sometimes the numbness can just happen automatically by having a sense that the hand is resting against a cool pane of glass, a cool window in the most beautiful, comfortable cabin in a snowy landscape. And as you have a sense of resting that hand on the pane of glass, seeing through the glass, snowing outside the cabin, feeling the coolness of that glass on the fingertips, the blue numbness spreading from the glass, cooling that hand cooler and cooler as you go deeper and deeper into the experience, cooling that hand further and further, numbing the hand as a blueness from that window sets in. Maybe aware of the comfort in the cabin, perhaps a crackling fire in the fireplace in the cabin, seeing what the snow looks like as it falls outside the cabin, while that hand numbs even further and faster with each breath that you take. And others find that what leads to that hand becoming numb is having a sense that someone comes over and swabs that hand with a numbing liquid, swabs the hand with some anaesthetic, and perhaps you notice the coolness of the anaesthetic, trying to work out the sensation of its liquid and noticing it almost evaporating from your skin, as if like an alcohol swab, where the alcohol evaporates not long after contact, and as it evaporates, so it takes away the residual feeling from that hand. And so you notice it being swabbed, maybe the sensation of that swab as it passes over the fingertips, the back of the hand, or perhaps the hand is already too numb for you to notice anything at all. And the hand gets swabbed with that anaesthetic. And as the liquid dries and evaporates, so the residual feeling, the last of the sensations in the hand, evaporate off with it. And other people find that the hand goes numb by having a sense of stepping out of your body, or having a sense that that arm separates from you. And as that arm is separate from you, as if you've moved yourself over slightly from that arm and left the shell of that arm resting there, no longer a part of you, but a part from you. A shell of an arm that you could see and not recognize as being you, or recognize as being you, but notice it's not a part of you. And you can have a sense, perhaps, of a dial that you can turn down. And as you turn that dial down, and I don't know whether it's a large dial with a slight arrow on it that points to where that dial is pointing, or whether it's more of a lever, but as you turn that dial, you can turn down any residual feeling in that hand, leading to a deep sense of comfort and nothingness, a blueness in that hand, like that hand is so numb and comfortable. And in a moment, you can transfer that numbness to a different location on your body, and you can do so with a simple touch And so the numbness in that hand can continue to increase, and you can tell yourself, whenever I want to make my hand numb, I can do so by telling myself that my hand is going numb. That's it. And you can always keep all this in mind. That's it. And you can transfer that numbness to anywhere on your body or within your body. Or even throughout your body. And that hand is so numb, with any residual feeling fading away. That it's almost like it's just nothingness resting there. Immobile, so still, until you decide to move that numbness elsewhere. But before you move that numbness elsewhere, remembering that every time you do this and practice this like anything else, you'll get better and better at it, and it will be more and more effective each time you practice. And the more time you put into practicing, engaging with this and following along to this, and practicing doing this for yourself, the better and more effective it will become. The quicker and number that hand will become, the quicker and easier it will be to transfer the numbness from one place to another. And when you practice this, then you'll get better and better. When you practice this and get better and better, the results will continue to improve. And before you transfer the numbness from that hand, you can have a sense of a blue light wrapping around that hand, swaddling that hand in calmness, numbness, peace and tranquility, a deep sense of relaxation, perhaps a deep blue coolness. And that can wrap around, and that blue light wrapping around that hand mops up any last feeling within that hand. It mops up any last sensations within the hand, and that blue light passes through the hand, deep within the hand, wrapping, blueness pulsing, calmly cool light, gathering up and dissipating any last feeling or sensation from within that hand. And I'll go quiet for a few moments as it continues to do that, and while I am quiet, so the light can continue to mop up any residual feeling. And once all the feeling has been mopped up, then the light itself dissipates, and you'll just be left with yourself and that numb hand. That's it. That's it. And then you can take some time to practice transferring that numbness elsewhere. Maybe you want to transfer the numbness to the other hand to practice first. And maybe each time you listen to this, you practice transferring that numbness to different places until you know that you have full control of making that hand totally numb and transferring that numbness to any other part of you. And so you can take a moment to very gently reach to where you want the numbness to go, touch that location, and just have a sense of the numbness transferring from that hand to that new location. And as it transfers to the new location, so the feeling in the hand will come back as if the hand is absorbing the feeling from that new location, and that new location is absorbing the numbness from the hand. And you can do that now. Transferring the numbness. That's it. Perhaps even seeing in your mind's eye or having a sense of the blue numbness moving, transferring, maybe feeling it almost like a liquid transferring, or like a coolness, or a blue light, or maybe a slight tingling in the new location as that transfers to the new location. Just holding that and letting it transfer fully. And when you notice it has fully transferred to the new location, then you'll be able to move the hand back to your lap or to its original resting place. And as you do, that only helps to increase the deepness of the transfer as you move that back. And you can now notice how in that new location, that numbness increases with each breath that you take. The numbness continues to increase until it's all-consuming and fully occupying that new location with a deep, calm, pleasant, relaxing numbness. And each time that you practice this regularly, you'll get better and better. Your results will increase. You'll find that you can do this quicker and quicker, easier and easier, more and more effortless, practicing moving the numbness around different parts of your body. And pain's obviously a signal, and so you need to respect the signal. But there are times when you can make that area numb using this technique. And once you have mastered this, all you need to do is make sure it's safe to do so, and sit down and rest your hands on your legs or the arms of a chair. Look up through the skylight in the roof of your head. Count down from 3, 2, 1. Close your eyes. Drift inside and allow that numbness to form, perhaps in a hand first, before you transfer it to the location you would like it. And I'll be silent for a little while as you continue to develop that new numbness in its new location. As you continue to just have the residual feeling, if there's even the slightest residual feeling there at this point, just fading, drifting away easily and effortlessly. And after you've done this for a while, then you can just tell yourself that you're learning this easily and effectively, and that you can use this anytime it's needed, and that you'll practice this regularly to improve, and that you'll get better and better results with each time you do this. And my silence can also help this become more effective, and that numbness deepen in intensity and quality. In the most pleasant way. And you can continue experiencing this deeper and deeper, knowing that you can count yourself back to the room just by counting 1 up to 3 and opening your eyes at a time that suits you, that you're ready to do so, that you know you've learned and gained everything you can from this here and now.